Bismillahirrahmanirrahim. A 10-day-old baby, shock, acute abdomen. What do you do first? 45% of the doctors got this wrong. Let's find out if you're one of them or no. Read this one carefully. A 10-day-old boy is brought to the emergency department with bilious vomiting for the past 8 hours. Okay, that's the chief complaint. Okay, he's been increasingly irritable and refusing to feed. His last bowel movement was yesterday. That's good. He was born with full term. Okay, no complications there. No complications. Temperature is this. Blood pressure is this. And heart rate is 172. On examination, the abdomen is firm, tender, and distended. Bowel sounds are absent. Stool testing is positive for occult blood. What is the next best step in management? Okay, look at the options. Before we start ruling out, look at these vitals one more time. Blood pressure is 78 over 42. Does this ring a bell? What does this ring? Of course, one thing, and that is the baby is unstable. Whenever you see blood pressure findings like this, just get happy in the USMLE questions at least, because it rules out a lot of things. This blood pressure actually rules of a lot of findings. Let's see. This one fact eliminates 3 options in this question. Let me show you how. A CAT scan of the abdomen. Look at this one. Let's start with option C, the CAT scan of the abdomen. This is the wrong answer here. And just remember one rule for USMLE. If you don't remember anything in this whole vignette, just don't remember anything, but just remember one rule, and that is you never do CAT scan in an unstable patient. Never. CAT scan is for stable patients. This baby has a blood pressure of 78 over 42. You cannot put a baby in shock inside a CAT scanner. This option, gone. Just fix it into your memory. Never do a CAT scan in an unstable patient. Either it's a boy, it's a girl, it's a male patient, it's a female patient, it's an elderly, it's a pediatrics patient, whatever it is. Do not do a CAT scan in an unstable patient. Never. That's a big no, okay? Look at this option. Option D, upper GI series with small bowel follow through. Okay, now this one is a little sneaky. Upper GI series is the gold standard for this diagnosis. I'll be revealing this diagnosis at the end. I don't want to spoil this question, but I want you to tell you. I want this to tell you that whatever this diagnosis is, if you're clever enough, you already know what the diagnosis is. But don't worry, I'll be revealing it at the end. Whatever the diagnosis is, it's the gold standard for this diagnosis. Upper GI series is the gold standard to diagnose this condition. Okay, but there's one catch here. Only in stable patients. Okay, this patient is not stable. If this patient is not stable, rule out the CAT scan and rule out the upper GI series as well. The baby is unstable. For God's sakes, you don't have time for imaging. Why would you do a CAT scan? Why would you do an upper GI series? You don't have time. The baby is dying. If you don't do anything in 10 minutes, he'll die. This option, gone. Look at this option, supportive care with serial abdominal examinations. Any person with a normal brain and having a little common sense would not do supportive care in a person who is dying. Okay, watching and waiting while a baby is in shock, that is not supportive care. That is just watching a baby die. This option, gone. Now I'm left with only 2 options. This is how you solve a USMLE question. Okay, always rule out the wrong options, and you should have a reason that why are you ruling them out. Because I do have a very strong reason here. CAT scan, you don't do it in a stable patient. Upper GI series, you don't do it in a stable patient. Supportive with serial examination, you don't do it if you have a normal brain. Okay? Now you are left with only 2 options, the contrast enema and the exploratory laparotomy. Now one of these options is actually what 45% of the doctors chose, and that was wrong. Okay? So your wrong answer here is contrast enema. Okay? Congratulations. This is your wrong answer. Now why is it wrong? Okay, when do you do contrast enema? There are actually, I want to tell you, you do contrast enema in almost two diagnoses for the confirmation of 2 diagnoses. One is Hirschsprung's disease, and the second one is the intussusception. Hirschsprung's is not the correct answer here because they already told you his last bowel movement was yesterday. Okay, but look at this baby, 10-day-old, in shock, acute abdomen. Buddies, contrast enema takes time to set up, time to perform, time to read. This baby doesn't have that much time. Every minute you spend setting up that enema more bowel is dying. Gone. This option, gone. And whatever this diagnosis is, you don't even use contrast enema for that. It's not helpful. Which leaves us with only one option, and that is exploratory laparotomy. This is your correct answer. Exploratory laparotomy, the surgical option. Go to the OR immediately. And here is why. I'm going to reveal you the diagnosis. The diagnosis is malrotation with midgut volvulus. During the development, the intestines fail to create properly. Okay, the intestines fail to create properly, fail to rotate properly. When feeding started, the bowel twisted on itself. The bowel twisted on itself. This twist is called a volvulus. This twist is called a volvulus. Okay. Now, volvulus is basically cutting off blood supply to the entire midgut. Right now, as we speak, every single minute without surgery, more bowel dies. Okay, there is no time for imaging, there is no time for enemas, there is no time for anything. You go to the OR now. Write this rule down with you. Bilious vomiting in a neonate is malrotation until proven otherwise. You look at the stats, you look at the vitals. If the vitals are stable, this is your correct answer. This one, upper GI series, this is your correct answer. If the patient is unstable, no matter what, open the patient right now. And this is what actually differentiates you from the rest of the doctors. And this option is what 45% of the doctors missed. Subscribe for daily USMLE MCQs and free MCQs daily. WhatsApp link in the description.